Now, part of understanding diabetes and diabetes management is knowing the numbers. We hear about your numbers with diabetes. There's a lot of counting carbs. There's glucose levels. So how do you explain this to your patients and help them keep track of it, Elise?
Well, the first is I encourage them to get involved in a program, whether it's if they're pre-diabetic and they get involved in the DPP, Diabetes Prevention Program, which is a free program for the community, or coming to a diabetes educator and meeting with a diabetes educator and meeting one-on-one. And in that session, it may last an hour to an hour and a half, and we do an assessment and we see what their needs are and what they're willing to change. And most people afterwards feel more relaxed because they feel like they have control, they know what they need to do, and it's not as overwhelming as when they first hear about the diagnosis.
Exactly. LB, let me bring you in because I saw those risk factors that talked about weight. Obviously, that is huge. Just losing that little bit of weight can really just be a game changer, right?
Yeah, every pound you go down, you're definitely going to get into a better category of being healthy, especially bringing diabetes into the equation. I mean, there's been plenty of evidence that have shown BMI, so basically your height to weight ratio,
Your body mass index
is extremely correlated to diabetes. And when you bring the weight down, a ton of other health factors can decrease and increase along with that. So bringing weight down is a crucial part of managing this disease.
Just adding on to that, a 5 to 7% weight loss is so significant. It makes such a difference, especially if you're pre-diabetic. There's a good chance if you lose a 5 to 7% weight loss that you may never even develop type 2 diabetes.
Look at that, just 5 to 7. We're not saying 50 or 70%, just 5 or 7%.
Which is not a lot.
Right, it could be about 10 to 15 pounds.
Right.